A patient at the Mayo Clinic recently played a violin during his operation, giving doctors a window into how his brain worked in order to better treat his symptoms. The doctors were performing deep brain stimulation, a procedure that could be the key to unlocking some still hidden secrets of the mind and perhaps eventually treat everything from Parkinson's to depression. Joining us now to talk about this is Dr. Alfred Ogden, neurosurgeon at the Columbia University Medical Center. Dr. Ogden, great to see you. Thanks for being here.
It's nice to be back.
So tell us a little bit about deep brain stimulation. It sounds fascinating. I mean, I think to the layman, the first thing that jumps out is how can someone be conscious and having an operation go on in their brain?
Well, deep brain stimulation is one of the most, I think, interesting and futuristic areas in neurosurgery. We're actually trying to manipulate circuitry in the brain that is faulty. And the procedure, in gross terms, involves a small hole being drilled into the skull and using very careful, what we call stereotactic guidance, which lets us know exactly where in the brain we're going. A very fine electrode is placed to a very specific place in the brain and then turned on. The procedure is done awake, typically, and the reason for that is it's not a very painful procedure. It's just the opening part that's painful. The brain itself has no pain receptors, and therefore putting a probe into the brain is not painful.
Fascinating. So does the patient just feel a little bit of pressure, or? So
the patient's awake, but they're in the sense that they're breathing on their own. A breathing tube is not placed, but during the opening, they are asleep. Okay. And then we do use local anesthetic, so they don't feel that part.
Right.
It's just that they need to be awake for the later part of the procedure, where we need to have them do things to ensure that we're in the right place.
Fascinating. And so in this case, the musician was playing his violin because he was a professional violinist, but not everybody has to do that, right?
Right. So in this particular case, the patient had a condition called essential tremor, which is an uncontrolled tremor of the hand, which was presumably affecting his ability to play the violin. And so in this particular case, they had him play the violin as they turned on the stimulator, the electric signal that's sent to the area in the brain where the probe was, to see if the tremor went away. They could have had him do probably a more simple physical activity, maybe even just hold up his hand. But this is a particularly dramatic example of how effective this therapy can be.
It's fascinating. And so deep brain stimulation is also used to treat Parkinson's right now? Is that right?
So the category of diseases that it's used the most for, has been used the most for, are movement disorders. So movement disorders are a broad category of neurologic diseases that result in a difficulty controlling movements, abnormal movements, sometimes difficulty initiating movement. And these medicines are treatable with oral medicines, but sometimes this doesn't work, and sometimes after a period of several years the medicine stops working. And indeed, the medicine sometimes produces undesirable side effects after long-term use. So
that tends to be the first step, is trying the medicine, and then if that doesn't work or stops working, deep brain stimulation becomes an option?
Yeah, absolutely. Okay. So, you know, if someone who's newly diagnosed with Parkinson's or essential tremor or really any neurologic disease, the first step is not to consider neurosurgery. Right. It's really only after medicines have failed.
And yet there is some indication that this deep brain stimulation can also help with depression. Is that right?
Right. So there were some anecdotal observations that patients with Parkinson's who often have depression had an elevation of their moods and an amelioration of their depression symptoms. And theoretically, any disorder, any neurologic disorder that comes from faulty brain circuitry could potentially be benefited with stimulation.
So do doctors know yet why depression seems to be eased in some of these patients?
Well, there are clear anatomic pathways that are either active or inactive in depression that can be affected by stimulating certain areas, other areas.
But yet there must be in the field some that are a little skeptical about going this path for depression. I wonder if maybe, you know, the history of lobotomies and the rest of it still taints that, or is that?
That's absolutely the case, especially in this country. Because the procedure of frontal lobotomy was an old, very crude procedure. It was formed years and years ago, really before the advent of many of the medicines that treat psychosis, which is what it was done for. And was not precise, so it really involved disconnecting the entire frontal lobe from the rest of the brain, and it's couldn't be any different from what we do today in terms of precision. And the other important thing to realize is that the stimulation procedure is reversible. It can be turned on and off with the battery. It can be removed.
Very interesting. So is this being prescribed then for people with serious depression, or not yet?
It's something that's being investigated more in Canada and Europe than the United States because there is a social stigma associated with surgery for behavioral disorders in this country that's not quite as prevalent elsewhere.
Right. And what about the future? I mean, what does the future hold for deep brain stimulation? It seems like there are all kinds of indications.
Well, you know, like I alluded to before, theoretically, any time that there's faulty circuitry in the brain, deep brain stimulation is theoretically possible. So psychiatric disorders such as depression, obsessive compulsive disorder, again, when medicine has been refractory.
What about, let's say, obesity?
Epilepsy. So obesity is another thing. There is evidence that another deep brain structure is hyperactive and causes, in certain patients, them to eat uncontrollably, and if that could be attenuated, they might not have the drive to eat as much.
So the science here could go in so many different directions.
Yeah. And of course, the next step also is stem cell research, so using the ability to target certain areas of the brain to deliver stem cells and get certain neurons that have died, for example, in Parkinson's, the dopaminergic neurons in the substantia nigra to regrow. It's still cutting edge for neurosurgery and will require a lot of research really to see which diseases are amenable and which are not.
Dr. Ogden, thank you so much. This was a fascinating discussion. And remember, for more on all the latest health and medical news, head to the health page at abcnews.com.